Hello. Sometimes when you are planning for pregnancy and you visit your doctor may say that your pregnancy can be high risk. Or you are pregnant and you go to your doctor, and after seeing your nose or taking the history, he may say that this pregnancy will be a high risk. So a panic button is pressed. You'll be stressed because this term high risk will make you feel stressed. Now, what is this high risk pregnancy? If you have a high risk pregnancy, that means you or your baby may be at an increased risk before pregnancy, during pregnancy, or after delivery. Okay, that's what we call a high risk pregnancy. And if in that cases, you may need some special care, or your baby may need some special care after delivery. Okay, in today's program, we'll tell you what are the risk factors that are associated with high risk pregnancy and how we can overcome them. Okay, so the first thing which we'll discuss are the predisposing factors which will make your pregnancy high risk. Sometimes this high risk pregnancy is because you have a medical condition before your pregnancy, or it may happen that you are perfectly alright, but during pregnancy you may develop a medical condition, or your baby may develop a medical condition that will put your pregnancy at high risk. Now we'll discuss the different points which are associated with a high risk pregnancy. The first thing that comes to our mind is an increased maternal age. That means if you are over 35, this pregnancy is usually a high risk pregnancy. The reason behind that, there is an increased risk of miscarriage, or because of your age, you can have a high blood pressure or develop blood diabetes during your pregnancy. Number two is that if there is a medical conditions like blood sugar, blood pressure before pregnancy, or you have asthma which is not controlled properly, or you take medicines for epilepsy, that may cause your pregnancy to be a high-risk pregnancy. The other factors can be your previous surgery. Suppose you have one or two previous cesarean sections, or you had an operation in your uterus to remove your fibroid or a tumor. That operations or any laparotomy for other reason will put your pregnancy into a high-risk category. Okay, and sometimes everything was absolutely fine, but during your pregnancy you develop high blood pressure, which we call preeclampsia, or you may develop diabetes, which we call gestational diabetes, which usually happens during the pregnancy. Or your blood pressure, or there is urine in the protein which we call preeclampsia, will put you or your baby at risk of having different trouble. Or sometimes there is a lifestyle issue. If you are overweight before pregnancy, or if you smoke or you take alcohol which is beyond the normal regulated limit, then your pregnancy becomes high risk. So the question will come to your mind that what steps can we take to prevent high-risk pregnancy, or we can have a healthy pregnancy. Now, if you know that you have a risk factors which can make you a high-risk pregnancy, like there is a genetic disease in the family, or you take medicines for diabetes or blood pressure, then the best way to do is to visit your doctor before you fall pregnant, what we call a preconception clinic. What happens in preconception clinic? Here your doctor will go through a detailed history, okay, and then we will find the risk factors, and we will try to keep everything into control. Suppose you take different medications for your high blood pressure, and not all the medicines are safe in pregnancy. So we'll optimize the dose, we'll see which medicine is safe to take during pregnancy. Suppose you take quite a few medicines for your epilepsy, we'll try to bring it down to one or two medicines. You have a genetic problem in the family, or in your previous pregnancy you have a baby who is not very well. In that case, we'll refer to a geneticist, and we'll try to find out the cause and we'll try to find out how we can prevent it. Okay, so this is one of the things which we can do before your pregnancy, or you can screen you whether you have a thalassemia, or if you have immunization against rubella infection. In that case, we can give you vaccination. Now, what happens is that if you develop the risk during your pregnancy, then what we do is called a multidisciplinary care. So, if there's a medical problem, we refer you to a physician. If there is any other problems like you are not gaining weight or you are overweight, we'll refer you to a dietitian. Or suppose you are feeling a bit low during pregnancy, sometimes because of stress, then we can ask you to meet a counselor who can take you through this stressful situation. So there are plenty of ways to avoid that. Now our question will come to you that whether we want to do some special test to prevent the complications. Now during pregnancy we do quite a few routine tests to rule out that you don't have any problem during pregnancy. We call them first trimester screening, like from 11 to 13 weeks of your pregnancy we do this test, some blood test, some scan, and we screen the pregnancy into a high risk or a low risk. If you're low risk, it's absolutely fine. Suppose if you're a high risk and there is a risk of some genetic problem, then we offer you different tests like NIPT or amniocentesis or chorionic villus biopsy, depending upon the gestation of the baby. Now, our job as a doctor is to give you all the information regarding this test, and then you decide along with your partner that what you want to do. So you are taking an informed decision. We won't tell you do this or do that. Depending upon your circumstances, you will be asking us what we have to do for you. Then what happens is that if there's risk of preterm labor, in that case you may have some extra ultrasound to see the length of the cervix or the neck of the womb length, and we can stratify whether you can go into a preterm labor or not. Sometimes we do some extra scans like growth scan to see how the baby is growing, and we take a decision depending upon that which is the best way of delivery and how we can make the baby safe. If we diagnose some problem in the baby, we ask you to visit your pediatrician so that you have a plan that why we will be delivering the baby and what we will be doing just after the delivery. In that cases, we will prefer to deliver in a tertiary center where there is a good facility. After the baby is born, the baby will be taken good care by the specialist doctors. Now, as we discussed before, that when we say that your pregnancy is very high risk and you become very anxious, now what will you do to avoid this anxiety? It is quite certain that you are anxious about your health and you are more anxious about the health of the baby. In that case, we suggest you that you talk to your family, you talk to a friend, or you talk to a lady who had similar problem before. So in that case, that you can share your stress with others, number one. Number two, you will know more about the complications and you know how to deal with it, and a positive energy will come to you. If you have any queries, which you think is unanswered, just ask your doctors, your friends. We will help you to give all the informations and to overcome the stress and to carry on the pregnancy and to have a happy ending. Now, in today's age, what happens, I tell you something, the next thing you will do is you will open up your smartphone and start Googling it. And you will get lots of informations. It's good to know what you are having, but too much of information is sometimes not very good. You see it in the Google, you give a keyword and lots of complications are there. That doesn't mean that you will be having all the complications or your baby will have all the complications. Yeah, you get your idea about the disease or the problem, then you come to us and we'll tell you in a tailor-made way, what are the things you can have. So this is what I will summarize in high-risk pregnancy, that yes, you have increased risk factors compared to someone who is low risk, but nothing to worry about that. We have a whole team in support of you, your obstetricians, the physicians, the pediatric doctors. We are all there, and if we deliver you in a tertiary setup, we will be having a happy ending, a healthy mother and a healthy baby. So nothing to worry at all. Thank you very much for your time.